Yes, breastfeeding can be painful for the patient, especially when you start breastfeeding the baby for the first time, because nipples are not used to so much of sucking all the time. So yes, it causes pain, but the maternal instinct and the good feel that it gives, mostly mothers are overcome or are able to overcome it. But important is that breastfeeding, if done in a right way, then it would actually not cause so much of pain. The proper handling of the baby, the proper sucking mechanism of the baby, not letting the baby suck too long, sucking breast unnecessarily for long hours, avoid pulling the baby from the breast. All there are certain things with that, with a good lactational consultant or a good advice by the patient, mostly the painful episodes can be avoided. Breastfeeding is good for both mother and the child. Side effect in the sense are like pain, the initial pain that the mothers get, the cracked nipples, another thing that mother may faces. Then if mother keeps on making the baby suck the empty breast, then also it may cause pain. The other breast may get engorged sometime. If the breasts are not repeatedly, milk should be expressed. If baby is not feeding and you feel your breasts are heavy, you should express out a bit of milk and keep them soft always. If they get engorged, they may tend to get infected. Sometimes it may get so bad that sometimes it has to go, on a small operative procedure. The breast milk, if get infected, can turn into pus. It could lead to breast abscess and lot of pain and and the surgery later on. And then you have to prevent the milk from coming. So to prevent all this, it is best to continue with maximum breastfeed that you can. These are the only thing that may come up with breastfeeding. Otherwise, per se, it is only good for both mother as well as the child. See, ideally, if you can, you should. So there is no reason that you should not breastfeed your child. Even with things like, if you are to, even in COVID, we have not asked a patient not to breastfeed the child. That was so infectious. In spite of that, breastfeeding was continued. And in many diseases also, it's never asked patient to stop breastfeeding. Even with certain medicines that are harmful, then only we try to give break a few days. Otherwise, there is no reason not to breastfeed. But for some reason, if you are not able to breastfeed, the baby won't get the good nutrition. He would be feeding on the formula milk. That good formula milk can add on everything. It will give us that protein, fat, carbohydrate. But what about the live antibodies? What about the immunities that are only going to come to the breast milk? So the baby who is not breastfeed would not get the best gift of his life from the mother. That are the immunities that comes naturally, immunity that you get from the breast milk. Then the bonding, the baby close to the breast, hear that heart sound, he has been used to listening inside. So that gives lot of protection, that feeling of bonding, mother and child relationship, that all comes with the breastfeeding. You put the baby to breast, you stroke the baby, you kiss the baby all that long. So that is a beautiful bond that develops between the mother and child. So if not otherwise, baby should be breastfed.